Welcome. Thank you for joining. My name is Claire Topal. I'm Managing Director of Red Tomato Consulting, and I will be your MC. I am delighted to ask Takako Oyabu, Takeda's Chief Corporate Affairs and Sustainability Officer, to begin our program with a few welcome remarks. Takako, over to you.
Hello and welcome. I'm excited that you're here with us as we gather on the sidelines of the UN General Assembly. We have an opportunity to reflect on a year of impact and call on leaders to invest in health systems around the world. Since 2016, Takeda has worked with partners to understand and address healthcare needs worldwide. For example, this year, our partner Mercy Corps provided resources for communities facing impacts from climate change in the Caribbean. Emergency response resiliency hubs helped 3 million people meet basic health needs. This included providing water security, natural resource management, and energy access, all crucial for people in vulnerable areas. Partnerships have been vital to advancing our commitment at the intersection of health and climate change, from climate-resilient infrastructure to greater workforce preparedness. Underpinning all of this is our motivation to build a resilient health system. And while we are proud of our achievements, our work is far from done. Today, we have the privilege of hearing from some of our partners making an impact on the lives of millions. We are also delighted to announce our 2024 awardees selected as part of Takeda's annual employee vote. These organizations were chosen based on their focus in critical areas, including infectious disease testing, workforce development, and community education. Over the past 243 years, we have learned the importance of adaptability across Takeda's philanthropic partnerships. And with our partners, we work to understand the challenges of tomorrow. I'm excited for the discussions today and the inspirations we will receive. I'll now hand it over to our MC to get started.
Thank you, Takako. Now let's get started. Today, we are very fortunate to have Dr. Leslie Mancuso, President and CEO of Jhpiego, a Takeda Global CSR Program partner, as our moderator. Leslie is a champion for health workers and vulnerable communities and really a true public health and cross-sector collaboration innovator. And Leslie, we're so glad you're here to guide this discussion today. Over to you.
Well, thank you so much, Claire. We have an exciting morning and it'll go by fast, but I'm really thrilled. Good morning, good afternoon, good evening, everyone online. I particularly also want to recognize the Takeda employees. They're about 20% of the participants today are from Takeda. So welcome. We're so glad you care about these issues about global health and this intersection with climate change. So today we come together to discuss the critical intersection between global health and climate change. I think it's important to begin with a shared understanding of the complex realities we face. The average temperature on our planet is now 1.2 degrees Celsius warmer than before the Industrial Revolution. The last decade was the warmest on record, and our oceans, which are vital to life on Earth, have been experiencing unprecedented heat waves. Now, these facts are not just numbers. They reflect the rapid climate changes that are already impacting millions of lives, particularly in vulnerable regions and with vulnerable populations. The Intergovernmental Panel on Climate Change has highlighted that 3.6 billion people live in areas highly susceptible to climate change, and over 99% of deaths are already attributable to climate-related changes, and they occur in the developing countries. And children make up 80% of deaths. Low-resource countries and small island states endure the harshest impact, with death rates from extreme weather events 15 times higher than in less vulnerable regions. What's more, climate change also weakens many key factors that contribute to good health, such as employment, housing, equity, equality, access to healthcare, and social support systems. During today's conversations, we have the opportunity to reflect on the outcomes of partnerships that have sought to address these urgent challenges in sustainable ways. Takeda's collaborations with Jhpiego, SFH, Rwanda, and Mercy Corps exemplify what can be achieved by bringing together global expertise and local knowledge. In rural India, Takeda's generous investment with Jhpiego has already reached 250,000 women with safe, quality maternal, newborn, and child care using innovative, sustainable approaches that strengthen the health system. By the end of the project with Jhpiego, 1.5 million women each year will access life-saving care. This partnership and the wonderful ones you'll hear about today will provide valuable insights and can serve as a springboard to a broader discussion on how we as a global community can better address the health impacts of climate change. How can we tear down silos and build resilient health systems using client-centered integrated care model that empowers healthcare providers? How can we transform the lives of millions by changing policies and building primary healthcare systems strong enough to withstand the challenges of tomorrow? Climate change is not just an environmental crisis. It's a global health emergency. To address these crises, we need a bold vision and courageous action. As leaders gather at the UN General Assembly, we must advocate for stronger commitments from high-income nations, and we must push for a global response that prioritizes the needs of those most affected by climate change. The time for action is now, and the responsibility lies with all of us. Now, I'm excited about this important conversation we're going to have today, and I believe you will be excited from hearing from our upcoming panelists. These panelists, each is a leader in their own field with deep experiences, developing and implementing innovative and scalable solutions that strengthen health systems. I have met them, I have talked to them, and I'm sure you're going to be equally as excited as I am to hear from both our two panelists. Our first panelist is Manasseh Wandera. He is the Executive Director for the Society of Family Health, Rwanda. You will see his bio attached to this program. Our second speaker is David Nicholson, Chief Climate Officer for Mercy Corps. So I'm first going to go to Manasseh. And Manasseh, I want you to set the stage. I want you to talk about your partnership and, very importantly, what health impacts or risks to climate change you've been able to see and how you see your group addressing them. So we're going to start with Manasseh and then we'll move to David. Manasseh.
Thank you very much, Leslie, and thank you so much for the organizers and everybody attending. I'm so excited to be part of this exciting panel and having very, very important and close to heart conversation. So to your question, the issue of climate change and health is definitely something that is really so critical, in my opinion, and of course, there's every data to prove that. At Society for Family Health, we are more focused on behavior change communication and also health systems building. And in our partnership with Takeda, we have been able to work with different communities. In fact, we are building over 20 health facilities. And what we have seen from our previous work and this partnership is serious impact of climate change on health infrastructure, healthcare workers, and the supply chain of health products, drugs, and medicines to the communities. As a practical example, climate change has had a significant impact on how this health infrastructure is able to deliver health services to the communities, especially in Rwanda. In the districts where we are working, we have experienced significant number of climate change related hazards, whereby some of the infrastructure are being affected, and there is a need to really focus on developing and delivering climate that are really stressed out because of the climate change and shortages in terms of the supply of medicines and the drugs, just because of these changes in climate change. As a practical example, where we are working in the eastern part of Rwanda, we recently experienced a lot of rains, and actually in the northern part of Rwanda, which have had significant impact. So in terms of the health workers who are supporting in these rural areas, there has been increase in the mental health and pressure around health delivery. So to mitigate these changes, our partnership with Takeda and nurses on the front line to make sure that they can be able to handle these challenges with relevant tools, but this is really not enough. There is a need to really have policymakers work with community members and all the global actors to make changes that really support these aspects, especially the infrastructure, health delivery in terms of the supply chain, and also in terms of training health workers and equipping them with relevant tools to handle these issues. I have another practical example whereby, because of the climate change and all the related hazards, we have had significant migrations, people moving from the areas that are hard hit to concentrated areas in the refugee camps. And that brings all the challenges around hygiene, disease, malnutrition. So those have really been big challenges. And in my opinion, I think it is very, very important to really look for solutions, including digital health and probably AI, to equip the community health workers and design the health infrastructure to make sure that they can be able to respond to these hazards, because it is no longer a problem of when, it is here and with us now. There's also need, I think, to really have multi-sector engagement, especially the manufacturers, the policymakers, the practitioners, to develop practical tools that can really help community health workers, nurses on the front line to be able to solve this problem.
I'm going to stop you there. I know you have a lot to say, and I'm coming back to you. So it was very exciting to hear what you're doing in Rwanda and other areas. David, I'm now turning to you. Same question. We're ready.
Great. Thank you, Leslie. And thank you to the Takeda team for inviting me to speak today. Very quick introduction to Mercy Corps for those who haven't heard of us. We're a global humanitarian organization. We're working in more than 40 countries around the world. So I have 6,000 plus colleagues and working side by side with people as they live through poverty, disaster, violent conflict, and the acute impacts of climate change. And we're increasingly focused on these acute impacts of climate change. And I think, Leslie did a great job of framing why this is such an urgent challenge. And the reality is that those least responsible for this problem are those most impacted. And that's a real animating force for us here at Mercy Corps. Leslie also mentioned small island developing states as an area of particularly intense impact. And that's certainly true in the Caribbean, which is one of the regions Mercy Corps works in. We responded over the last decade, we responded to several significant extreme weather events and realized along the way that, there has to be a smarter way. This cycle of emergency response is not going to be enough, and we have to start investing in resilience and working with local partners to help people better anticipate, prepare for, and ultimately withstand and thrive in the face of these climate disasters. So one of our approaches in the Caribbean is what we call resilience hubs. And what we do with the resilience hubs is we partner with local partners to usually upgrade existing community buildings to enable them to provide critical resources and services for vulnerable communities facing hazardous extreme events like hurricanes. So these resilience hubs, they deliver health and social services during emergencies, but they also function year round, offering things like reliable potable water, energy for health, medicine storage or other for Wi-Fi, for connectivity, different forms of communication, and community gardens. And they try and provide this sort of wraparound community hub that can serve as a center for resilience building. They also provide disaster risk reduction training to help communities feel better prepared and be able to respond in those acute moments of emergency that we know we're going to see more of. Takeda is supporting Mercy Corps scale this model up. It started in Puerto Rico, where I was actually part of our original response team for Hurricane Maria. And we've since, developed a model we think can be effective in multiple locations. And thanks to Takeda's generosity, we're now scaling that to 5 other islands around the Caribbean, and with the goal of, saving lives, improving health, and building resilience for more than 3 million people. And Leslie, if you'll permit me, I'd love to take a step back, because this is one example of the kinds of work that we do to build community resilience. But it's worth pausing a little bit on what these words mean, right? We talk about climate change adaptation, we talk about community resilience, and we've been thinking about this at Mercy Corps for over a decade, and people their eyes used to glaze over when we said resilience, but it feels like it's becoming a little bit more familiar to people. So when we talk about resilience, we're talking about both the ability to cope with the immediate impacts of an extreme event, but also then adapt to the changing conditions so that people can thrive as our environment around us changes and the pace of change is increasing. So it means more than just responding to a disaster, right? You've got communities, we've seen communities can get stuck and not, get stuck in this cycle of need for humanitarian response, and we have to help communities move forward. So ultimately, that means being able to predict and anticipate a shock, and being able to make sure that systems of livelihoods, social services, health services can withstand those shocks that we expect. And these are all very dynamic, right? All of these things are very interconnected. And climate and health, as what we're talking about today, is, of course, very, very linked in these environments. We know that community resilience starts with the resilience of individuals, and the resilience of individuals starts with their health. So basic health services that can be present as extreme weather events or ongoing stresses occur is vitally important. Access to medicine as well as food, water, and ability to support themselves is just key to a vision of resilience. And that's something that we've been working on more and more, and I can share more examples as we get into this discussion.
Well, thank you so much, David. I think both Manasseh and David, you've brought up a lot of points, and very important points. One of the things you just talked about, David, was the preparation and making sure communities and the health system is prepared, not just being reactive, but being resilient, making sure they're able to be flexible, adaptable. Manasseh, you gave incredible information about all that you're doing with the community. And I wish I could ask you a lot of questions. But one of the things I wanted to know is, what are you doing to prepare for the future? Not just reacting, but how are you looking at what support systems are you putting in place, whether it's with health workers, which I know is a big part of what you're doing, but what are you doing so that you're preparing them to respond as opposed to just reacting when there is something? Manasseh.
Thank you very much, Leslie. One of the things we have been focused on to be really proactive is to make sure that we educate the communities, but also bring along the policymakers and community leaders. So basically, a tripartite of the policymakers, the local government leaders, and the community practitioners who are supporting the population so that they have the information, they understand the magnitude of the danger. That's number one. Number two is to develop homegrown solutions. For example, in Rwanda, where we're building the capacity and the capabilities of community health workers, the issue of mobility and transportability in a very highly terrain environment is very, very critical. So in terms of preparation, in terms of kind of understanding really the magnitude of the problem and how to navigate in case it hits, because it hits all the time. There is a predictable cycle of events, but it's also those that are abrupt. How do you go about that? Then number two is really to work with different institutions. For example, the Rwanda Medical Supply, which provides medicines, drugs, and other essential supplies. So the collaboration between different partners, ministries of health, ministries of agriculture, ministries of environment, and the transport body to make sure that they have this understanding and readiness. That's what we have been doing. Then other things really build on that based on every event that happens. It is so critical that they have this understanding, partnership, and readiness.
Thank you, Manasseh. I think what you just described is what we were talking about earlier, which is having this global expertise, and at the same time, that local knowledge of what partners to bring together, who you needed to bring together in order to make a community-wide, health system-wide change, if you will, that's both in preparation for and in the ability to react when there is a situation. And I think certainly your focus on health workers is so very important. David, let's go to you. Same question essentially, but you talked a lot about what you're doing in the Caribbean and obviously have done a lot with resilience. Tell us a little bit more about how you got the communities to adapt. What did you do to build this? And obviously, you also talked about how it's been spread. And how did you get that? Because one of the things we all know is it's not just about the immediate region that you're working in that health system, but how do we get other health systems to see it? So please, David.
Yeah, it's this question of, how to get people to understand the challenge of climate change. We find in our work that usually the people who understand most clearly are community leaders and community groups, right? They know things are changing. So even though at times we have to fight policymakers and funders to pay attention and to channel resources, it's not difficult to convince local partners and community members that there's a problem here, right? So what we found is that initial mobilization is not difficult. The challenge that we have is to make sure that we're bringing in the right kind of information for people to feel real, and when I say people, we're not just talking about individuals here. Decision makers at multiple levels are able to, access sufficient information and feel part of this sort of global effort to solve this challenge. There's a whole wealth of information out there, right? It's never as simple as connecting people to some fancy modeling system so they can look at maps online. That's a part of it, but there's a lot more to it than that. But as soon as you start to break down some of these larger challenges into very context-specific challenges. Okay, we know that in this location, we are facing more of these kinds of shocks. We've experienced them. So then what do we do? How do we build resilience? And this question of what builds resilience is such an important one. One thing that we've invested in a lot at Mercy Corps is to go back, soon after a disaster, an extreme weather event, or a period of extended stress, go back and see where are the positive deviants? What actually worked? Where do we see the pockets of resilience that we want to scale up? Which communities have done well? That was some of the work we did in Puerto Rico after Maria, and saw that there were communities that did have something equivalent to these resilience hubs. They had really strong community centers that provided that immediate support. People were able to demonstrate to partners, to policymakers, to local government that there's an indigenous model here. There's something that works that we can invest in together and to grow. So that's really key to find those things of what works, because it is overwhelming, right? But there are humans everywhere, communities everywhere have good ideas of how to prepare for and are quite used to doing this in many places. So finding those positive stories, being able to build the evidence out to show, sometimes our policymakers want really quantifiable evidence of progress, and we understand that, right? So can we show a return on investment? Can we show investing up front, saves X dollars down the road? Those kinds of calculations really matter. So for the Caribbean specifically, the work that we've done since the partnership with Takeda, we've been engaging many community groups or civil society organizations, which are very sophisticated across the Caribbean, to see, to share the information, share what's been achieved in Puerto Rico, to share that model and see where does it stick, where does it resonate with people that can take this forward themselves. Mercy Corps not showing up in new islands in the Caribbean and just starting to build resilience hubs, right? We're trying to figure out who are the local partners that can do that. Where is there the enthusiasm to take this forward? And then we can provide that partnership, those resources and the evidence from one location and help it grow elsewhere.
That's great. Well, I know even in our work in India, we've been able to, we had a visiting group from our country programs in Botswana that came to India. They were able to take back some of the Takeda work that we're doing, the innovative solutions for child health, for maternal health, and they're already taking those innovation point of care strategies back to Botswana, which is what we should all be caring about, is how we take what we're doing and are able to get these interventions, these ideas, these strategies over to other countries. Now we are over time, but I'm still going to ask this question. So each of you, I want you, today is about call to action. Today is about what are we going to do? So I'm going to ask each of you very quickly to list your call to action. So Manasseh, I'm going to you first, David, to you second. Manasseh, your call to action is today.
So we very well know that climate change is a stress accelerator to the health workers. So there is really need for people in the government, especially ministries of health, to make sure that we equip the health workers to be able to handle this kind of stress by making sure that we give them force multipliers, like tools like AI, like digital health, like predictors of environmental changes that will have diverse effects. And this is very important. It should be done now. We cannot wait to do it once the catastrophe has hit. We have to be prepared right now. So number one is really to policymakers to prepare the right tools. That's number one. And hand them over to the right people who are hit hard by the climate change, like community health workers. Number two is to be able to really look at the resources like the supplies and the health facilities in a way that is mobile and climate change resilient. We had health was placed in different places based on the population, but now we have gone ahead in this funding with Takeda, this partnership with Takeda. We are now making sure that where we are placing the health facilities, we are anticipating some kind of climate change disasters and making sure that at least this will be will have minimal impact by climate change. So that means we can replicate that across the country and across the continent. So policy, practice based on what happened previously and what can resist more.
Thank you, Manasseh. Great calls to action. Let's go to David. David, calls to action.
Okay, so I have two. Firstly, to my fellow program implementers out there, please avoid the silos. It's a real temptation with climate action because it feels so overwhelming to create sort of very niche areas of sort of, health and climate and food and climate. The temptation for that is clear, and we do need to be able to get specific in our action, but successful adaptation resilience can only work when these things fit together as a whole and understand the climate challenge holistically on a community. So that's number one. And then for funders, my message is really simple. Be bolder. There's a myth out there that we don't know what works for adaptation resilience, so we're not really willing to put money into it. It's not true. In every context, things look a little differently. And, resilience programs are very processy because you have to learn as you go. But there's a lot of evidence out there of successful programs now. We've been doing this for over a decade. There's lots of lessons learned, as have many of our peers. So we call on partners to be bolder and take a few more risks with people who have good ideas to ensure that we can accelerate our impact.
Thank you so much, David. And I would say for Jhpiego, our calls to action are to develop, certainly to integrate climate resilient care into primary health care, ensuring that key areas are included in primary healthcare, investing in digital health solutions, planning for sustainability and scale, and developing climate resilient care, helping healthcare teams to anticipate and respond, just what we've been talking about today. So those were the calls to action. Now we have questions from the audience. And I know this is moving fast, but we actually have a number of questions, which I love all of them. That's the problem. But there were questions specific to each of you. So David, I'm going to start with you first because I've always, poor Manasseh has been asked each time first. David, have you thought about incorporating AI and predictive technology to mitigate the impact of climate change?
Yes, this is a huge topic in the climate world right now, and we could spend hours deep diving into the intricacies of it. But I think the top level answer is yes, we've certainly thought about it, and the potential is huge. There's various entry points for AI that we're very interested in. Certainly, from a global modeling perspective, the potential is massive. But recognizing where, being able to predict local impacts of events more accurately to trigger early warning more accurately and quicker is a big potential for us. And we're working with lots of partners that do this. Mercy Corps could never do that alone, but it's a huge opportunity. The final thing I'll say quickly is actually providing targeted guidance and advice to people is a huge opportunity. Mercy Corps has an agriculture program called AgriFin, where we send advice and support out to millions of farmers across sub-Saharan Africa. And we're actually using an AI chatbot now that's sort of ring-fenced in all the appropriate ways that can access all of the appropriate information and get advice out to people in very specific targeted areas to when to plant, how to adjust their calendar, when to harvest, lots of specific advice that AI, enables us to do at a much greater scale. So huge potential there.
David, there is so much about what you just said that I want to ask about 10 questions of, but to me, this is an area that we do need to be looking at, that all of us need to be looking at, that predictive analytics, looking at AI and how to do things differently, if you will. I also loved your point earlier, which I want to reinforce to the audience, avoiding silos. I think any of us in global health have lived with silos most recently, and I think there's no doubt that we have to get away from that. So I love your comments. Thank you so much. Now, Manasseh, I think you answered this question, but someone did ask it, so I maybe it gives you an opportunity to reinforce. The question to you was, how do you engage the communities in co-developing interventions? So again, it goes back to that question of what you were talking about, but how do you specifically engage your communities to develop the responses and the interventions you're doing?
Our core interventions are really at the community level. We work with community health workers, with households. We work with community leaders in a really more friendly engagement sessions. And this is based on our expertise in terms of how to be able to engage people and be able to know exactly their needs. So this one, the needs of the people that we find out coupled with what is exactly happening previously, we are able to determine courses of actions. So basically, one-on-one engagement, household engagement, and then developing action points that are really incorporated within policy. For example, in the northern part of our country, recently we experienced massive floods. And after those floods, then we are able to engage the people and say, should this happen again, how else should we be prepared to handle such activities? And we have developed plans on how to handle those in terms of behavior, in terms of preparations, and even in terms of settlements. So basically engaging and taking appropriate actions based on predictable events. We have also actually, in the current partnership with Takeda, where we're building health facilities, we have engaged another company called Sun Technologies, which is helping us to predict epidemics. And with that prediction, then we are able to engage those communities in advance to see this is the likely epidemic that is likely to happen here. Should it happen in this period of the year? What should we do in terms of agriculture, in terms of health, in terms of settlements, and in terms of relations? And how do we cope with stress? So by increasing more resources, both technical resources and knowledge resources.
Manasseh, that was, I think, your closing points about what you're doing to look at predicting. I think that goes back to some of what David was talking about and what the question was. I think we have to be looking at that, and that is what resiliency is, if you will. I have one final question, and we have 4 minutes. So I'm going to ask the same question to both of you. David, I'll go to you first on this as well. How do we make action around climate and health feel achievable and compelling to policymakers and funders rather than overwhelming? And I think it goes back to this, not making it an either or, but how do we make it achievable because it's all one? So David, I'm going to go to you first.
It's a huge question, and I can't possibly do justice in that time.
A huge question, and you get 2 minutes.
Yeah. So let me just say a couple of things on this. One, there's no question that the climate crisis feels overwhelming at times, and how could we possibly do anything? But we know that we can. So I think the key, there's 2 things that I think that our work at Mercy Corps we find really helpful in getting into practical action. One is spend the time stepping back and understanding in a location what is actually happening here. What are the specific climate risks and who do they impact in specific ways? It's hard to find time to do that analysis sometimes, but it's really, really important because it helps you get from sort of lots of generic language and the sort of esoteric language to a specific set of threats to a specific population group, because these shocks impact different people in lots of different ways. So once you have that time to do the analysis, understand that, then you're able to get to concrete solutions that are specific, but are sort of embedded in that larger vision of the climate crisis in a particular place. So, sometimes it's easy to rush to action, but that methodical thought process is really valuable, I think.
Thank you so much, David. And now the same question to Manasseh. How do we make action around climate and health feel achievable and compelling to policymakers and funders rather than overwhelming?
That question speaks to really what we have been really thinking at SFH. One of the most important things is to be able to expose out with empirical evidence to the government leaders who allocate resources and who design policies. And we do that by engaging in different technical working groups to show the impact of doing something against waiting to do something after. So, and that has yielded results in terms of really looking at the data and being able to allocate resources, because it is cheaper. It is cheaper to act ahead of time than to act after action. That one we have really seen. So engaging with the communities and getting the real data, using that data to really put it into middle and high-level managers in technical working groups, and then appealing to the policymakers. Number 2 is really engaging the politicians, say members of the parliament, members of the cabinet, to be able to visit particular communities and see it for firsthand, more than the reports and the statistics, to be able to engage firsthand at the community level. So that one really appeals to their emotional aspect. When they're making policies, you can see changes. So both evidence, but also firsthand information and field visits.
Thank you so much. So I think what we've talked about today is, both of you have reinforced the elements of health systems and the elements of how we need to build resilient health systems. And there's no doubt for all of us, for Jhpiego, for SFH Rwanda, and for Mercy Corps, we've all benefited from the incredible investments of Takeda to allow us to look at what works, to collect data on what works, to use that evidence, to work locally with our communities, to work with our government partners and policymakers, and to make sure that we're not only being reactive, but most importantly, we're preparing our health systems for the response and making sure that we're working locally to create the solutions that make sense for all the settings and the different settings that we're working in. So I want to thank you all. I think you all had really incredible points. Manasseh, your points on health workers and the importance of that, your words on working with the local communities and how you were able to transform them, your predictive analysis, your recent comments about data. David, you gave us an incredible examples of what you've been able to accomplish, the fact that Mercy Corps has been in this work for a long time. I think your comments about avoiding silos, but I think I want to end on the comments about being bold. You know, each of you, and I would say Jhpiego as well, although I'm the moderator, each of us has solutions. We each have done incredible work with the benefits of Takeda and these partnerships, as well as the work that we're doing around the world. This is not something new in the sense that we need to take this and these lessons learned about what we've done with health systems and make sure that others know how to do it and that it expands from here. So it is now 9:15. I am now turning this over. I think they were sweating, but I did make it. I'm now going to turn this over, but I want to thank Manasseh. Thank you so much. Thank you to SFH Rwanda. Thank you, David. Thank you so much. Thanks to Mercy Corps. I really appreciate you being here today. I now turn it over to Claire.
Thank you so much, Leslie,
Thank you very much.
Moderation. And thank you, Manasseh and David. That was a great conversation. And we know we're leaving this hungry rather than stuffed. We're hungry for more. So I encourage everyone to really look up these organizations, these projects, and keep talking with our speakers. I'm now excited to turn to Takeda's announcements. First, I'm going to ask Zhang, Takeda's Head of Public Affairs and Patient Advocacy in China, to announce the results of our employee vote. Over to you.
Thank you, Claire. Hello, everyone. My name is I'm Head of Public Affairs and Patient Advocacy at Takeda China. My contributions to Takeda CSR program fill me with great pride. I'm proud to help Takeda support communities to address health challenges. I participate alongside 79 other colleagues across 20 countries and business functions as a member of our application review committee in this year's selection of our Global CSR Program finalist. The entire committee and I were inspired by the thoughtfulness and creativity of every proposal. In addition to helping select finalists, I also cast my vote more than 22,000 colleagues in our company-wide employee vote. On behalf of my colleagues across 80 countries, I'm pleased to announce the Global CSR Program. Now we have 5 new partners. First, we will partner with Population Service International to expand vaccine access through pharmacy-based immunization across 3 countries. Second, we will partner with Bengaluru Incubator to train community health workers and scale health literacy in rural South Africa. Third, we will partner with Richard Cameron to increase access and quality of essential health and psychosocial support service in hard-to-reach communities experiencing long-term conflict in 3 countries. Fourth, we will partner with Seed Global Health to support 3 countries and Zambia in building a skilled health workforce. Fifth and finally, we will partner with Village Reach to enhance the speed and the reliability of infectious disease lab sample transportation in 5 countries. Congratulations to our new partners. Claire, back to you. Thank you.
Thank you so much, and congratulations to these partners. And we're really excited we have the opportunity to hear from each of them right now. So I'm first going to invite Rajan Woodruff, Executive Director of the Bulungula Incubator, to share a little bit about what this new partnership with Takeda makes possible. Rajan.
The Bulungula Incubator has been working for 20 years in remote rural communities in places where some families, half of which had lost at least 1 child to diarrhea, 1 in 9 had lost 3 or more. The Takeda grant helps us to ensure that nobody is left behind, and in a way that can be scaled to other communities such as these. Thank you for all your efforts on our behalf. We are looking forward to this new partnership with Takeda.
Thank you so much, Rajan. I'm going now to turn to Carl Hoffman, President and CEO of Population Services International, to share a few words. Carl, over to you.
This is so exciting. We thank all the employees of Takeda for expressing this confidence in this exciting program, under which we're going to reach close to 1 million people in 3 key African countries, using the pharmacy channel to provide life-saving vaccination services. This is going to be good for pharmacies, good for people, and good for the entire health system, and we are determined to make it a success. Thank you.
Thanks, Carl. Next, I'm thrilled to ask Esther Njomo, Executive Director of Reach Out Cameroon, to describe Reach Out's new partnership with Takeda. Esther.
Greetings from Cameroon. On behalf of Reach Out Cameroon and its partners, it is our absolute delight to partner with Takeda on this important project that will increase access to quality sexual and reproductive health rights services for women and girls in 270 conflict-affected communities of Cameroon, Nigeria, and the Democratic Republic of Congo by 40% over the next 4 years. Thank you.
Thank you, Esther. I am now very pleased to ask Andrew Musoke, COO of Seed Global Health, to tell us about Seed's new partnership with Takeda.
With your support, this grant will train 6,000 new doctors, nurses, and midwives, and thousands more additional health workers who are already in service to augment their skills. These newly trained health workers will serve a population of over 76 million people in Uganda, Malawi, Zambia, and Sierra Leone. To do this, we'll partner deeply with health educational institutions, hospitals, and clinics to train highly skilled health workers to deliver evidence-based and patient-centered care. Thank you so much, Takeda employees, for your support of this work.
Thank you very much, Andrew. Finally, I would like to invite Emily Bancroft, President and CEO of Village Reach, to describe Village Reach's new partnership.
Epidemics often start with a few cases, then spread rapidly, and that's why timely diagnosis is so important. Yet in many countries, getting samples from hard-to-reach communities to labs can take weeks, and sometimes results even longer. This project aims to change that. With Takeda's support and working with local governments, Village Reach will improve lab sample transport systems across 5 African countries, leading to faster diagnosis, quicker treatments, stopping outbreaks, and saving lives. Because when someone is sick, time matters. Thank you, Takeda, so much for your support.
Thank you, Emily. And thanks to all 5 awardees for sharing this background. Now I'm excited to ask Tueshe Ando, Head of Global CSR and Partnership Strategy, about Global CSR Program's next RFP. Tueshe, over to you.
Great, thank you, Claire. And congratulations again to our new Global CSR partners. Now, as promised, I'm delighted to share a preview of our Global CSR Program 2025 Public Request for Proposal, or the RFP. The RFP provides detailed guidance on our theme, proposal tracks, and application form. They'll be publicly available on the Apply for Funding page of our website, takeda.com, on September 19. That's actually tomorrow, by 9 a.m. Japan time. At that time, our new application form will also be live in our digital donation management system. This slide contains details about the application timeline. Upon launching our RFP on September 19, registered organizations will be able to begin filling out applications for the RFP cycle. Applications will be due on October 31st at 11:59 p.m. Japan time. This year's RFP is focused on applications that are supporting the development of health systems that are more resilient to the impacts of climate change in vulnerable communities. This reflects Takeda's strengthened emphasis on climate-driven health impacts as part of our giving strategy. The 2025 RFP has 3 proposal tracks, including investing in more reliable health infrastructure, educating the workforce about climate-related health risks, and developing technology solutions that enable more effective treatment for climate-vulnerable populations. On October 8, we'll hold another webinar dedicated to the RFP and to answering your questions about the application process. That will be open to the public. You'll all receive invitations to register following today's webinar. We appreciate the time and energy that it takes to submit these applications, and we're grateful that so many organizations with such exciting experience, work, and insights have joined us today. We look forward to your applications and hope to see you at the RFP webinar. Thank you. Back to you, Claire.
Thank you, Toshie. Thanks for sharing this overview and this preview. I know many organizations with us today are interested in submitting proposals. Leslie, Manasseh, and David, thank you so much for sharing your insights and calls to action. AIR, we really appreciate your bringing the passion and enthusiasm of Takeda employees for global health. That really shines through. Congratulations once again to Takeda's 5 new partners. To everyone attending today, thank you so much for sharing your time and energy. Hope you've come away with a better sense of Takeda's global CSR efforts and really how we can all frame calls to action to leaders gathering next week and beyond. Please stay tuned for the invitation, as Toshie mentioned, to the October 8th RFP webinar that Takeda is holding about the RFP. And don't forget to check out the RFP document when it's live tomorrow morning, Japan time. A final note of thanks will close out our event. And then when you close your webinar screen, there will be a survey that pops up. And we'd just be so grateful if you could take just a minute to fill that out and tell us about your experience today. Thank you so much again for joining us. And Takeda, thank you very, very much for all your work and support in global health.